become a fully qualified vet takes years of study, copious amounts of prac work, and many days in the field. Once you get the job, that's when the real work begins. Each day, vets around Australia are busy taking care of a range of animal species, from cats and dogs to cows and horses. Today we're going behind the scenes with some very talented vets who are dealing with some extraordinary cases. And first is a little fluffy dog called Charlie, who's had a very big accident.
Hey, sweetie. I know you don't like standing here, Charlie.
Sit. He loves being out there with the kids, and then the little 2.5-year-old took him up on the slippery slide, and next minute we heard a squeal and the kids came running and said something's wrong with Charlie, and Charlie had fallen off the slippery slide.
Charlie was rushed to the vet immediately, and it was quickly discovered that he had broken both his front legs. The vet gave him some emergency treatment, and thankfully he survived the ordeal. And today he's due for surgery.
The plan today is that Charlie will have some plates inserted in each of his front legs. Sometimes surgery doesn't go according to plan in that his legs are so tiny. His bones are literally 4 millimetres in diameter. So it may be that we have to change tact partway through, but the plan is to insert plates because he's broken both his front legs midway through his, what we would call his forearm. So plating is certainly the best option.
These plates apparently are only 2 millimetres wide, so they are incredibly fine plates, and I just hope and pray that it all works out all right, you know, because I don't want to lose him.
Due to the complexity of the operation, the vets have the assistance of a specialist veterinary orthopaedic surgeon.
I'll just get all my instruments ready.
The little plates going into Charlie's legs are very small and thin, but they have to be cut exactly to size if he's going to be comfortable.
With him, once we get the fracture exposed, we'll decide how many screws we need, and then we'll just cut the plate exactly where we want it for that number of screws, and we'll do that for each leg.
The vets waste no time getting the lengthy procedure underway. They move fast as they insert the new plates into Charlie's legs. Almost there, and by the look of it, Charlie is faring pretty well. And done.
So what we've done is just put the bones back together and stabilised it with a plate on each leg, and in the right leg there's 9 screws and in the left leg there's 8 screws. And then we've sewed it back up. So now he's got 2 straight legs again, but we need to get an X-ray to make sure that everything's in the right place.
So these are some x-rays taken of Charlie the day he fractured his leg. So you can see this is his left leg with a nice clean break through both of the bones. And if we go to his right leg, you can see that this one as well has a nice clean fracture through there. So you can now see that he has had a plate with multiple screws implanted, and you can see that the bones are now nice and straight. So we can see that then if we go to his other leg, or the other view, we can see that his leg's in a nice alignment with this white metal plate on top of it. So, and again, this is the other one on the side. So he's got very nice alignment through there, so we're very happy with how everything's gone.
He'll be able to walk pretty much straight away, but it will take about 6 weeks for the bone to heal completely, so he won't be allowed to do any running or jumping, getting on and off the furniture until then. And we'll take another x-ray in 6 weeks' time just to make sure that it has healed completely.
Very relieved. I was pretty nervous. I was pretty nervous, although I knew that he was in good hands.
And of course, the final obvious question is, how will Charlie get through airport security?
Fly down south a couple of times a year, and he comes with me. But I believe he doesn't go through security. He just goes in the hole.
A few months down the track, and Charlie is looking tip-top once again. Coming up later, we'll watch some other vet procedures on animals that you don't encounter every day.